Good morning, everybody. Together with my friend, colleague, and co-president John Wong, it's a great pleasure to welcome you all here at the 5th World Health Summit, which is a special event because it's the 5th time we have this event in Berlin. We started off in 2009. Before, we always have been at the Charité, some modest academic facilities for meetings. This is the first time we are in the Weltsaal, the World Ceremonial Room of the Ministry of Foreign Affairs. And I welcome members of Parliament, excellencies, ministers, senators, and many, many prominent people. We will welcome those of the session as they are coming up to the podium to speak. Let me just briefly say that the World Health Summit has ambitious goals, and we want to improve world health, of course. This is something nobody can do alone, and this is something which you don't have a recipe for. This is a result of discussion, and this is a result of collaboration of many, many people around the world. This is the opening session of the World Health Summit, and traditionally it is being opened by the international president, Professor John Wong, Provost of the National University of Singapore. And John, you have kind of the ceremonial baton in your hands, and I leave the floor for you, and then we call upon the speakers. John.
Thank you very much, Detlev, and very good morning, Minister, Senators, Ambassadors, Deans, CEOs, colleagues, ladies and gentlemen. It's really a tremendous testimony to the vision of Professor Detlev Ganten and Germany and the Charité to host the World Health Summit. And although this is a young summit, this is the 5th time the summit has been held, a tremendous amount has been achieved in helping shape global health issues around the world. Singapore was very privileged to host the first meeting outside of Berlin in Singapore in April of this year, and we had more than 1,000 people attend, and the feedback has been unanimously positive. And there's several people here in the audience who came because of the regional meeting in Singapore and saw the value of the World Health Summit. So I look forward to the next 3 days of extremely rich and fruitful discussions. But the most important outcome of this meeting is an understanding that we have to work collectively, that everyone in this room, everyone who attends this summit, and our networks all have a tremendous role to play in shaping global health. So thank you very much, and I look forward to a wonderful meeting ahead. Detlev.
Dividing up our duties, we have agreed that I introduce the local speakers from Berlin, whom I know best, but I won't tell you everything I know about them. And John then will introduce the speakers from Singapore in the Singaporean opening session. And I have the great privilege to introduce to you Professor Ernst Rietschel. Professor Rietschel, the Germans know him all. He is an accomplished scientist, immunologist, anti-infectious diseases, and that's one of the major topics, as you know, of this program also. He has been president of the Leibniz Association, and now newly, he is president, the most prominent scientist in Berlin. He is president of the Berlin Institute of Health, which is a completely new institute. You probably tell us more about it, I don't know, which is a result of the so-called Excellence Initiative in Germany to promote universities, interaction of universities with federally funded institute, the Berlin Institute of Health, President Ernst Rietschel.
Ministers, Excellencies, Ambassadors, Ambassador Sohan, Senator Czaja, President Wong, dear John, Dean Kuan, lieber Detlev, ladies and gentlemen, dear friends. As a member of the steering board of the World Health Summit and as the chairman of the newly founded Berlin Institute of Health, it is my great privilege to welcome you all to this 5th World Health Summit in Berlin. We all have come here with the highest expectations, hoping that the 3 days ahead of us will overwhelm us with information, discussion, and the exchange of data, ideas, and new views. Together, I hope, we will strive at developing new ways, instruments, and strategies as to how human health might be improved on our planet. The World Health Organization defines health as physical, mental, and social well-being. In other words, the absence of this illness is an important aspect, but health goes beyond that. To improve health worldwide, therefore, research on global threats such as infectious diseases, but also, and more so, chronic diseases, must be rigorously promoted, integrated into social sciences, and the scientific results be effectively translated into medical diagnosis, therapy, prevention, preemption, etc. Everybody has to do his homework in this context, and then we have to develop joint strategies for global action. Our homework here in Berlin, and Detlev Ganten has mentioned that, in the last year was to establish a new research institution, the Berlin Institute of Health, BIH, and I take the opportunity to thank you, Senator Czaja, for supporting this endeavor. The Berlin Institute of Health is a merger of Europe's largest university hospital, the Charité, and one of the highest-ranked institutes in Europe dealing with molecular medicine, the Max Delbrück Center for Molecular Medicine, also located in Berlin. The Berlin Institute of Health is a novel scientific institution in the capital of Germany, forming a holding, an umbrella, for the Charité and the MDC, the Max Delbrück Center. The BIH focuses its scientific and clinical activity on translation, mainly in the field of non-communicable diseases, including cancer, neurodegenerative, cardiovascular, and metabolic disorders, such as diabetes. These polygenic and environmentally influenced diseases represent the veritable epidemics of the 21st century in both low and high-income countries. Unlike other translational centers, and there are many of them being created in the world right now or a few years ago, the BIH, our institute, follows a holistic and integrative way from the bench to bedside and to health in the populations, a strategy we term systems medicine. At the heart of systems medicine stands the translation of our daily increasing scientific knowledge into clinical practice, and reciprocally, the translation of clinical observation back to the research lab, integrating the molecular and patient data into one coherent concept and drawing diagnostic or therapeutic conclusions thereof. All this has to lead to better health of the individual and, of course, of populations around the world, public health therefore being included in the concept of the BIH. In this way, we try to pursue a tradition initiated by Robert Koch here in Berlin more than a century ago, and he started with a single pathogen in his case, one factor, one defined agent, Mycobacterium tuberculosis, and leading to new concepts in the improvement of health and population in the case of infectious diseases. The symposium at this World Health Summit on polio eradication is an example for the high actuality of this topic. In contrast, the non-communicable disorders are multifactorial in nature, and the new challenge of modern times, system medicines, recognizes that one disease originates or may originate from different origins, and that different diseases may share common mechanisms. Inflammation, metabolic disturbances serving as examples. In implementing this overarching view, we feel particularly close to the concepts of medical and public health in Singapore, the home of President John Wong, where the concentration on common pathogenic principles such as inflammation, immune reactions, or metabolism are an important part of the translational medicine at the NUS, the National University of Singapore. Your work in Singapore, John, is an outstanding example as to how the medicine of the future, I should rather say global health care of the next century, should be organized. We are proud to have you here and welcome you as the president of the 5th World Health Summit. At the same time, we congratulate you, Ambassador Sohan, and you, Dean Kuan Yu, for the remarkable achievements of your country in the field of modern medicine. In closing, I would like to thank you all, the participants, for following the invitation of Detlev Ganten, the founder of the World Health Summit, to come to Berlin. Your expertise is needed if we want to advance global health. We are one humanity and only one power, namely knowledge being generated by research and science, will help to improve our health, our well-being, our lives. I trust that the days ahead will witness the essential role science plays for improving global health. In this sense, I'm confident that this conference will stand out in moving the concept of global health improvement to a new and hopefully unprecedented level. I sincerely hope that you will enjoy your days in Berlin and that the summit will prove to be for all of us a continuous source of personal, intellectual, and hopefully also emotional inspiration. Thank you.
Thank you, Professor Rietschel, especially also for acting as a local host and supporting us morally and, if I may so, also financially. Ladies and gentlemen, Berlin is a tortured city in its history. It's a city and a state, and in the core of the former Prussia, now it's called Berlin-Brandenburg. And some of you may or may not know, after German reunification in 91, 89 to 91, 92, everything changed. Nothing in East Berlin stayed the way it was before 89. And very little in West Berlin stayed the way it was before 89. Berlin is the laboratory of German reunification. And hopefully, and if we judge the development, successfully so. Berlin was in, say, from 1800 to 1914 and the following years, one of the world's leading capitals in science and technology, from medicine to physics and other areas. And then there was a historical period of decline and resurrection. And this, of course, was an interaction of civil society, courageous people in Berlin, in the East and the West, of politics, and of course also of science. And without politics, of course, nothing happens in the city. And I'm very happy to welcome Senator Mario Czaja, one of the youngest senators in town, one of the most efficient, one of the most popular, and a very promising politician in the city. I have the privilege, I came to Berlin right after German reunification in '91, and in a very modest way, I participated in the building up of the life science development in the city. And one of my early coffee partners was at that time an even younger member of parliament. And we had, if you remember, Mario, many discussions on how things should develop. And now you are the senator, and senator, by the way, in Berlin is the minister. So he has the power in the life sciences together with the senator on research and technology. He's very supportive. And if you walk through the city in the past 4 years, the World Health Summit was not an isolated event in Berlin, but it was an international event as many others. Now Berlin is developing according to the example of Singapore as a health city. Health is becoming, and the life sciences are becoming, the primary corporate identity building area in Berlin. And if you walk around, you see all the buildings illuminated. That's the Festival of Lights, and especially the buildings dealing with the life sciences and health industry and so on. There are about 300 different organizations participating in this Health Week around the World Health Summit. And Senator Mario Czaja is one of those who supported this development. Health Capital Berlin. And we are very privileged to have your presence, and I'm looking forward to your talk. Senator Czaja.
Dear Professor Wong, Professor Ganten, Professor Rietschel, His Excellency Jai Sohan, the Ambassador of Singapore, other distinguished guests, ladies and gentlemen. On behalf of the Berlin government, I'm very pleased to welcome you to the World Health Summit 2013 in Berlin. With approximately 1,000 participants from 80 countries, this World Health Summit is again a unique international discussion forum for decision makers in the areas of science, business, and politics, as well as for representatives from the civil society. In the next few days, you will all have the opportunity to gather in various symposia and workshops to exchange experience, debate current challenges of global healthcare, develop recommendations, and hopefully also offer some solutions to the world's most pressing problems in the health sector. It is obvious that diseases and epidemics don't respect national borders, and that health is a vital public good which of fundamental importance to people all over the world. Therefore, it seems logical, indeed imperative, that medical and health issues are discussed at the international level. Advances in medicine and health promotion activities need to reach everybody. This is the primary goal of the World Health Summit. We are pleased and proud that Berlin is venue of this Global Health Summit for the 5th time now. It was the right decision to organize this huge event in Berlin, since our city is ideally suited to host this international forum due to its broad experience in the field of science and research, in particular in the health sector. Let me give you 3 reasons for this statement. Berlin is open-minded and international, and it's a leading exhibition and congress location, including and in particular in the health sector. Secondly, Berlin has a huge experience in looking for strategies combining health and social issues. Medical advances have already been discussed in the context of social and socio-political issues in Berlin for the last few centuries. And Berlin has world-renowned healthcare facilities and the leading location for science and research. The University Hospital Charité, with its excellence in healthcare as well as in research and education, has a worldwide reputation, and it's one of the landmarks of the whole health region. Europe's largest university hospital was founded more than 300 years ago. Numerous Nobel Prize laureates have worked there. Renowned personalities, physicians and researchers such as Paul Ehrlich, Rudolf Virchow, and Emil von Billing worked in this university hospital and have changed the world with their findings. If we look at the work of Robert Koch and Rudolf Virchow, we will be aware of how much the results of their medical researches are still of significance in our modern lives. For instance, their scientific findings have significantly brought forward the development of hygiene in cities. Here are a few figures to illustrate the Berlin potential now. In the capital region, around about 300,000 people work in the healthcare industry. In about 6,000 companies, organizations, and institutions, or in one of the 7 technology parks focusing on life science in the metropolitan region. In this field, there are about 170 programs and 4 Max Planck Institutes, 2 Fraunhofer Institutes, 2 Leibniz Institutes, and 2 Helmholtz centers. The cluster of healthcare industry is not only one of the largest, but also one of the most successful and important in the framework of the common innovation and funding strategy of the metropolitan region, the federal states of Berlin and Brandenburg. In this context, the objective is primarily to promote networking between actors and institutions in the healthcare facilities and healthcare industry, in order to generate product and process innovations in order to further improve the quality of care. This goal also corresponds to the one the World Health Summit had set itself. In future, it will be even more important to combine basic and clinical research. As a result, we founded the Berlin Institute of Health only a few months ago. The new institute was founded from the merger of the Max Delbrück Center for Molecular Medicine and Clinical Research at the Charité. It represents a new model in translational research through which scientific evidence should become part of routine clinical care much faster and reach the patient at an earlier stage. Furthermore, Berlin's pharmaceutical, biotech, and medical device industries are among the most successful on the market. To give you some details, we currently have 23 pharmaceutical companies with around 10,000 employees, 200 biotech companies with about 4,000, and almost 300 medical device companies with approximately 12,000 employees. Famous names include Bayer Healthcare Pharmaceuticals, Sanofi Aventis Germany, Pfizer, Berlin Chemical, Otto Bock Healthcare, and Biotronic Germany. Furthermore, the concentration of 20 more major research institutions and universities focusing their research on life science themes is unique in Europe. Due to the international appeal of Berlin, we have succeeded more easily than other regions in attracting qualified professionals and scientists from all over the world to live and work in an international environment. Many global problems are related to health care. Among them, infectious diseases, the change in HIV infection from acute to chronic cases, as well as the mental disorders and age-related diseases. Among these global problems are policy-related issues, such as the impact of the global financial crisis on global healthcare, as well as the effect of health on relationship between countries. These are some of the issues you will discuss at this year's World Health Summit. Last but not least, the Berlin Health Week will, for the first time, be held in parallel with the World Health Summit. The Berlin Health Week addresses professionals as well as an interested international audience. Within the Berlin Health Week, we will have a number of very different events in which various healthcare inform the audience about global health issues and the institutions' activities in this field. But the World Health Summit is the core event of the Berlin Health Week. Ladies and gentlemen, I hope you all have a pleasant and exciting stay in our vibrant city, and I wish you and I wish us a very successful 5th World Health Summit. Thank you for your kind attention.
Thank you very much, Senator Czaja and Professor Rietschel, for your wonderful comments. I think that the one key message of the World Health Summit is that academics do not work in isolation. And probably one of the most important components of the World Health Summit is to try and bring people from different sectors, people who can and do shape policy. We are sitting here in the German Ministry of Foreign Affairs by no mere coincidence, because it is impossible for global health issues to be addressed without support, direct support as well as indirect support from our colleagues in the field of diplomacy and foreign affairs. So it's with great pleasure that I'd like to introduce the next speaker. Ambassador Jai Sohan is Singapore's ambassador to the Federal Republic of Germany. He is a liberal arts graduate from the National University of Singapore and has been a career diplomat for the last 28 years, being posted to some of the most important missions that Singapore has relationships with: Germany beforehand, Indonesia, Malaysia, and the United States. So it's with great honor that I welcome Ambassador Jai Sohan to share a diplomat's perspective of the World Health Summit. Ambassador Sohan, please.
Thank you, John. Professor Detlev Ganten, Detlev, my good friend, Chair of the Board, Charité Foundation. John, Vice Provost, National University of Singapore. Professor Rietschel, Chief Executive Officer, Berlin Institute of Health. Mr. Mario Czaja, Senator for Health, Senate of the City of Berlin. Professor Kishore Madhubani, Dean, Lee Kuan Yew School of Public Policy. Distinguished guests, ladies and gentlemen, a very good morning to all of you. I'm honored to be here today. The World Health Summit has been a highlight in the international calendar for the past 5 years. This year, however, marks a particularly significant year for the World Health Summit. 2013 saw the first World Health Summit regional meeting held outside Berlin. In April this year, was held in Singapore. For those of you who are wondering why the ambassador of Singapore, who's got nothing to do with the medical field, has been asked to speak to you this morning, this is one connection, the first regional meeting in Singapore. The other connection, of course, is that Professor John Wong, who together with Professor Detlev Ganten, are the presidents of this year's World Health Summit. I am personally pleased that Singapore was chosen for the first regional meeting of the WHS. This indicates two things to me. First, a recognition of the growing importance, opportunities, and challenges that Asia presents for healthcare providers, practitioners, and policymakers. As Asia's aging population base grows, and the prevalence of chronic health diseases increases, the region will be faced with unprecedented healthcare challenges. I understand that by the year 2030, Asia will have the unenviable honor of carrying half of the world's chronic disease burden. These challenges, combined with the rising affluence, will in turn fuel demand for better and more innovative healthcare solutions and systems. Asia will become increasingly relevant for healthcare practitioners and providers in the future. Second, I'm glad the World Health Summit regional meeting in Singapore gave the healthcare community a chance to see what Singapore has to offer in terms of being a healthcare hub for the region. We have established strong fundamentals in healthcare excellence. We are committed to finding innovative solutions that address the rising costs and inefficiencies of global healthcare systems. We have also built up a vibrant biomedical sciences ecosystem underpinned by favorable business conditions and infrastructure. This makes Singapore a natural gateway into Asia and an excellent launch pad for healthcare experts, companies, and practitioners looking to position themselves in the heart of the dynamic healthcare developments and demographic challenges in Asia. One final observation that I would like to make is this. Good healthcare systems must be supported by sound public policy. In Singapore, the government has made it a point to play a hands-on role in driving the development of Singapore as a healthcare hub, in promoting direct linkages between industries, researchers, and practitioners. This is something that Senator Czaja has also referred to earlier on in his speech. In this regard, I'm very, very encouraged to see that this year's World Health Summit has the support of the Berlin state government and also the official partnership of the Federal Foreign Office. I'm confident that this year, under Professor Ganten and Professor Wong, the World Health Summit 2013 will be a major success, as it always is. And Detlev, I look forward to working closely with you in future, on future World Health Summits. Thank you.
Thank you so much, Ambassador Sohan. While the rest of the world struggles with the issues of global health, and certainly Singapore is no different from the rest of the world, we still look for centers of excellence which have shaped a lot of what we've learned. And Germany certainly has shaped a lot of how we practice medicine. Last night, we had the traditional M8 Alliance dinner hosted in the Charité in Rudolf Virchow's lecture theater. And Professor Detlev Ganten never ceases to stir emotions when he stands in the same place that Professor Virchow used to stand in and address us. So again, we are very grateful for Germany's contributions to medicine, ranging from theory to practice. And I think that probably one of the world's greatest contributions from Germany has probably been aspirin. So it's with great pleasure. It's one of the traditions of the World Health Summit that the president of the summit hosts a symposium with a keynote speaker from their institution. And the National University of Singapore is delighted to showcase one of our leading academics who is not traditionally, I say traditionally, not traditionally from the field of biomedical science, but from the field of diplomacy. Professor Kishore Madhubani is the Dean and Professor in the Practice of Public Policy at the Lee Kuan Yew School of Public Policy at the National University of Singapore. Prior to becoming the founding dean of this school, he had a long and distinguished service in the Singapore Foreign Service, for more than 30 years, where he was in Cambodia at the time of the regime change, Malaysia, Washington, D.C., and in New York, where he served 2 postings as Singapore's ambassador to the United Nations and was also president of the United Nations Security Council in 2001 to 2002, when Singapore was holding a chair as a member of the Security Council. Kishore has published extensively, and I think one of the best things about being a friend of Kishore is to get onto his email list, because then you get to see his articles before they go to print. And he writes widely in foreign affairs, foreign policy, Time, the Financial Times, the New York Times, and several others. He has been an annual speaker at Davos for the last 14 years and has published 4 books which never fail to stir some element of controversy, with the latest being The Great Convergence, Asia, the West, and the Logic of One World. So this morning, he will present to us the topic, Can Global Health Become a Trojan Horse, bracket, good Trojan horse? And as I mentioned, there are a few things in life that they say you can say with certainty: death, taxes, and an interesting lecture from Professor Kishore Madhubani. Thank you very much.
Excellencies, distinguished guests, ladies and gentlemen, it gives me great pleasure to be here. And John, thank you very much for that generous introduction. From now on, it's all downhill, you realize that. I do want to begin by congratulating Detlev and John for organizing a spectacular World Health Summit here. And I have no doubt that some of you are very puzzled as to why this guy, a former diplomat, non-medical person, is standing up here. I share your same puzzlement also. But I guess the way I can be helpful is to suggest to you that as a result of the good work that you are doing, you can actually do a lot more for the world. And the way I plan to convey that message is to answer 3 questions. Firstly, is the world overall becoming a more civilized or an more uncivilized place? Second, what is the biggest obstacle to global cooperation to create a more civilized world? And thirdly, can global health, especially your global health institutions, play a role in creating a more civilized world? Now, to avoid keeping you in suspense, let me tell you that at the end of the day, my conclusions are very optimistic. I genuinely believe that each and every one of you in this room that can play a major role in developing a more civilized world. And in short, in the work you are doing to help individual human beings get better, you may actually succeed in making humanity better too as a whole. And if my thesis is right, and you'll see that my point at the end, is that all of you can serve as a kind of a positive, good Trojan horse to change the world order at a time when it needs to be changed fundamentally. So to get to that conclusion, let me first of all answer a very simple question. Is the world becoming more civilized or less civilized? I suspect that if we did an informal poll in this room, there will be the usual share of pessimists in this room saying the world is becoming more and more dangerous, and there'll be some optimists in this room. But I can tell you that if you look at the global situation objectively, we have no reason but to be remarkably optimistic about where the world is heading. And I want to make one key point to all of you. that is surprisingly not noticed by many in this world, that humanity as a whole has made far greater progress in the last 30 years than the previous 300 years. And if you want proof, let me give you 3 big items of proof. Firstly, the one thing that has actually killed more people throughout history, as you know, is wars. Then today, we live in a time when wars are becoming a sunset industry, and high-intensity wars which kill more than 1,000 people per year, have declined by 78% since 1988. Now, pause and think about where we are in the world today. A year from now, in 2014, we'll be marking the 100th anniversary of World War I, which, as you know, killed millions. Yet none of us worry about another World War I breaking out. And what's even more remarkable, I can tell you this, in the next 3 to 4 years, we will probably see the greatest shift of power ever seen in human history, where non-Western power is going to emerge to be the number 1 power in the world. And in PPP terms, China will be the number 1 economy by 2017. And yet we sit here calmly and not worry about a great war happening. That's how the world has changed positively. Another example of positive change, we've been trying to tackle global poverty and eradicate it for decades. We thought it was a mission impossible. In the year 2000, when I was ambassador to the UN, under the leadership of Kofi Annan, we established Millennium Development Goals. One of them was to halve global poverty by 2015. And guess what? We're not just going to meet that target, we're going to exceed that target of halving global poverty. And even the very conservative United States National Intelligence Council has predicted that by 2030, global poverty, absolute poverty, will disappear completely. Now that's a great leap forward in human history. A third example of positive news. All over the world, the global middle classes are exploding. Today, all over the world, there are 1.8 billion members of the global middle class. It'll grow to 3.2 billion by 2020 and 4.9 billion in 2030. Which means by 2030, more than half the world's population will be enjoying middle-class living standards. And an even more spectacular story in Asia is that today in all of Asia, from West Asia to East Asia, the total size of the global middle class in Asia is 500 million. But by 2020, which is only 6 to 7 years from now, the number is going to explode from 500 million to 1.75 billion. An increase of 3.5 times in 7 years. Let me stress this. The world has never seen anything like this. So clearly something remarkable and profound is happening in our time. And that's why, as John mentioned, I wrote this book, The Great Convergence, to try and understand why this is happening. Now, the answer I came up with in the book is that humanity as a whole is converging on a consensual cluster of norms, and it's the norms that we now share in common that enable us to progress together. And if you want proof, look at the people around you in this room. Look at the people coming from all corners of the world that are represented in this room. And yet you sit together and speak together as one human tribe and not even aware of your great differences. That's how the world is changing. So I can't continue to suffocate you in good news. But at the same time, you all know that there's also lots of challenges in the world. And believe me, challenges will continue, and I can talk about various challenges. Since we are in the German Foreign Ministry, I can give you a 1-hour lecture on geopolitical challenges that will come. I can talk to you about domestic governance challenges. But today I just want to focus on one great global challenge which I think that you can all help to solve. What is this one great global challenge? I try to describe it with a very simple metaphor, which I call the boat metaphor. Before the era of modern globalization, all of humanity, when we lived in 193 separate countries, it was as though we were living in 193 separate boats with captains and crews taking care of each boat and rules to make sure the boats didn't collide. And that was the 1945 rules-based order that we created. Today, as a result of the world having shrunk, the 7 billion people, and I must emphasize this, literally, not metaphorically, live not in 193 separate boats, they live in 193 separate cabins on the same boat, but you have captains and crews taking care of each cabin, and no captain or crew taking care of the global boat as a whole. And once you absorb that metaphor, you begin to understand why we are unable to deal with all these global challenges coming our way. And we get proof of it every few years. You saw this in the 2008-2009 financial crisis that began with the Lehman Brothers, spread around the world. And at the beginning of 2009, the world was at the edge of a precipice, the world economy about to fall off. Fortunately, the G20 leaders met in London. They came out their cabins, went to the bridge of the boat, launched a global stimulus plan, saved the world. So when it came to a crisis, we all came together. But when the crisis was over, the leaders went back to their cabins, and all the subsequent G20 meetings failed. Because the leaders are elected by their cabins and not by the boat as a whole. And you see this also as a challenge that we deal with in global warming. And you see this, of course, when it comes to pandemics, when they break out. And it's actually I hear a voice somewhere. It's either agreement or disagreement. Take the SARS virus. It broke out in a small village in China. From China, it went overnight to Hong Kong. And then from Hong Kong, it went simultaneously to 2 cities on opposite sides of the world, Singapore and Toronto. And you know what's significant about that? Singapore and Toronto are 2 of the cleanest cities in the world. But it didn't matter. When the virus breaks out, it doesn't matter if you keep your cabin clean, it's going to hit you. So we are all in the same boat. And so we clearly have to do something to strengthen the global boat and the governance of the global boat. And I want to emphasize a key point. I am not asking for the creation of a global government. A global government will never happen. Not in my lifetime, not in your lifetime. But we can strengthen institutions of global governance. And if we can do that, that would be a great leap forward. Unfortunately, one thing is holding us back in strengthening institutions of global governance. And I say this one big thing is that we are attached to a concept called sovereignty. Sovereignty is a concept, by the way, which is exactly 365 years old. It was a result of the Treaty of Westphalia of 1648. It was a great leap forward in 1648. But 365 years later, in a world that is so different, in a world where we are all in the same boat, the notion of sovereignty forces us to look after our cabins and not look after the global boat as a whole. So I actually believe that we have to work hard to try and eradicate this notion of sovereignty, and I believe that you, the health community, can do it very well. But just to give you one more example of how the notion of sovereignty prevents global cooperation, I think you're all aware of the famous conference in Copenhagen, climate change, global warming, 2009. And what's significant is that in January 2009, in his inaugural address, when he addressed the American people, President Barack Obama said very bravely and in a very visionary statement, "I shall not be the first American president to allow the planet to fry during my watch." He committed himself to fighting global warming. And yet, when he went to Copenhagen, as you know, the Copenhagen meeting failed because Congress tied his hands. Congress refused to give him any concessions so he could put forward to achieve a compromise. And as a result of it, we failed to achieve an understanding, an agreement on how to fight global warming. And all this a result of countries and governments focusing on sovereignty. Now, I tell that story also because even though I suspect all of us in this room agree that global warming is real, that global warming is a challenge that we have to deal with, people can't feel a sense of urgency about global warming. It may happen 20 years from now, 30 years from now, and so they don't feel motivated to make some immediate changes. By contrast, if a global epidemic or pandemic breaks out, then people feel it immediately. They feel that they may get hit by SARS or some other virus immediately. And that's why the global health community can do a much better job of persuading humanity that we are on the same boat than any other community in this world. So you can provide a kind of moral and political leadership that no other constituency can do so. So as a result of this, I hope that you will then say, hey, let us work together to strengthen global institutions. But it will not happen soon. And why will it not happen soon? And here, in all honesty, I did warn my friends in Germany that I sometimes do say things that are slightly provocative. And one of the provocative things I'm going to say, which unfortunately is the truth I learned after spending 10 years as an ambassador to United Nations, is that sadly, for whatever reason, it has been Western policy to keep multilateral institutions weak. This is not a big secret. This is actually quite well known. And the reason why the West did it, reason why America especially did it, America felt that multilateral institutions constrain American power. So they want to keep multilateral institutions weak so that American power can go on unchecked. But now, as we move into a different era, as we move into an era where America has to go from being the number one power in the world to the number two power in the world, I begin the book by quoting from a speech that Bill Clinton gave in Yale in 2003. And in that speech, Bill Clinton said, if we in America assume that we'll be number one forever, let's keep on doing what we are doing. We don't have to change anything. But then he added, if we can conceive of the possibility that we'll be number two, then surely it is in America's national interest to work to create a rules-based order that will then, I didn't say this explicitly, implicitly constrain the next number one in the world, which I'm going to tell you, by the way, is going to be China. So it is now in Western national interests to strengthen multilateral institutions. So in my book, I don't appeal to Western ideals, I appeal to Western national interests, and I say, please change your policy of weakening multilateral institutions. And if you want to change the policy, the best place to start is the World Health Organization. And it's actually quite remarkable that an organization like the World Health Organization, at a time when we live in a smaller and smaller world where diseases, pandemics are spreading, we should be strengthening the WHO. But we've been weakening the WHO. Don't take my word for it. I did a review of Kelly Lee's book on the WHO. I strongly recommend it to you. It's a little book, excellent book. She describes how in the 1970-71, the WHO received 62% of its funds from regular budget assessed contributions and only 28% from voluntary contributions. Today, you have the exact reverse, where only 28% comes from regular assessed contributions and 72% comes from voluntary contributions. You cannot build any organization in the long run on the basis of voluntary contributions. You have to have regular assessed contributions. And I can tell you, when I was asked by former President of Mexico, Ernesto Zedillo, to serve on the Commission of Eminent Persons for the IAEA, I was shocked at a time when the West was talking about the dangers of nuclear proliferation. They were also weakening the IAEA when they should be strengthening the IAEA. So clearly, the time has come for us to change our attitudes towards multilateral organizations, towards multilateralism, and work together to strengthen them, and we can begin to do so with the WHO. So let me conclude now by giving you 3 specific things that I think we can do together to try and create a better and even more civilized world than the one that is emerging. The first one, I've already told you, let us work to strengthen the WHO, make it a model of what good multilateral cooperation can be like, use it as a test case, strengthen it, make it more effective to fight global pandemics, and then we say, okay, the rest of the UN family can learn from it. Secondly, as I mentioned, many multilateral institutions, the reason why they are weak, one reason is because they've been financially strangled, deprived of regular assessed contributions. Let's change that. Let's give them more assessed contributions and less voluntary contributions. And this can be done. And I must emphasize to you one very important fact. Multilateral institutions are very cheap. When I served as ambassador to the UN, the total annual budget of the United Nations Secretariat, which was serving the whole world, was less than the cost of the New York City Fire Department for one city. That's how cheap it is. The amount of money involved is peanuts. And I think we can find it if you want to create a better world. But the third suggestion I'm going to leave, and I'm here, again, I'm going to be slightly provocative, is that I can tell you for certain that when the next United Nations Secretary General is selected, he will come from what is called the Western Europe and the Others group. I take a bet with any of you. It's regional rotation. Therefore, Europe has got a very big decision to make in 2016. Will you go by the past practice, and I've got to choose my words very delicately here, and try to pick a Secretary General who's like Dag Hammarskjöld, the boldest and the most visionary Secretary General that the UN has ever had? Or are you going to take the opposite course? And I can tell you, by the way, these are not secrets. If you read the memoirs of John Bolton, former United States ambassador to the UN, in his memoirs, he says when he and Condoleezza Rice were discussing how the UN Secretary General should be selected, he said, it's in print. Condi and I discussed, and we agreed we didn't want anybody strong to be a UN Secretary General. Now, that policy may have made sense when the West was completely dominant. But when the West today represents 12% of the world's population and an ever-shrinking portion of the global economy, it is now in Western interest to select the boldest and the most visionary European to become the next Secretary General of the UN. So this is why I'm very glad I'm giving this lecture in the Auswärtiges Amt, the Foreign Ministry of Germany, because this is the right place to lead the message. Thank you very much.
Well, thank you very much, Dean Mahbubani. This may be the last time that Singapore was asked to host the World Health Summit. But, all jokes aside, I think that if we all thought that we were going to come to Berlin because it's one of the most spectacular cities in the world, where there's great food, great culture, the museums are unsurpassed, the Berlin Light Show, if we all thought we were going to come to Berlin to do all of that, well, I think that Dean Mahbubani has given us new marching orders, that the call for a new world order, the call for captains of the ship, the calls for us to come out of our cabins has never been stronger. And we're delighted that we have strong representation from all the key agencies and institutions from around the world which can shape a better world. So I look forward to the next 3 days, and I thank all the speakers this morning for setting the tone for what I think will be a most memorable World Health Summit. Thank you very much.